Hi, this is Dr. Sandoval. I'm here with Dr. Nancy Lassiter. She is fairly new to our program. She joined us about 7 months ago, just in time for all of our COVID activities. She is our administrative director over critical care, emergency room, and our CVICU. So she's had her hands full. Today we're going to be talking with her and discussing some of our issues around family communication. So thank you, Nancy, for joining us.
You're welcome.
So the first question would be, as this COVID crisis started and we did not allow visitors to come in, what sorts of problems and what observations did nursing have and how that affected patients and families?
So I think nursing had some moral and ethical dilemmas with it, first of all, because we're used to having families included, especially in the ICUs when you're having end-of-life discussions or life and death decision making. So that was difficult for them. And they really did start using their own personal iPhones to have families on a video chat. So they kind of worked through that a little bit. And it's been probably about 3 weeks ago that I got called into an end-of-life discussion on a Friday afternoon because there was no one else to do it. So I ended up taking a lady up to the unit with her husband, who they wanted to withdraw care on. And I had my iPhone, and their daughter and grandchildren were in the van down in front of the heart hospital. And when I did it myself, I knew logically that it was difficult, but I never realized how difficult it was until I was in their shoes. And I had my small iPhone, and the screen was hard to see and maneuver and get them to see the family member and the mom. So after that, we really pushed hard to get some iPads. So we've now got iPads in place, and the screen is a little bit bigger. It doesn't tie up the nurse's personal phone or the charge phone because they may be getting phone calls. So that's one way we've used technology to help us with that. And we're also trying to communicate better with the patients and just identifying the key person to communicate with and having that communication daily with a communication liaison. It might be a tech in the unit, it might be a unit secretary, but it's someone who's calling that patient and updating them every day based on what the nurse and the doctor is saying from the ICUs.
Great.